Have you ever taken antibiotics for what you thought was a UTI, but the symptoms just kept coming back? Maybe the symptoms reduced just for a few days and then returned. Well, here's the truth. Not every urinary problem is a UTI, and not all antibiotics can fix it. Hello, welcome to Bulamu Podcast Talk Show. Here we inspire, heal, and transform lives through conversations that matter. I'm your host, David Nyamurangwa, and today we are diving into a health topic that is more common than you think, and that is urinary tract infections, or what most of you know as UTIs. So, what is a UTI? A urinary tract infection happens when the bacteria, most especially E. coli, enter and infect the urinary system, that is, your bladder, your urethra, and sometimes your kidneys. And when this happens, you will start experiencing a number of symptoms. For example, frequent urination with some associated burning pain. Sometimes you'll also experience low abdominal pain associated with lower back pain. Others will also experience a fever. And here is where it gets tricky. These very symptoms can also come from other conditions. For example, inflammation of the prostate, or what is known as prostatitis, STIs, and also other infections that affect women, or vaginal infections. For example, bacterial vaginosis. So you see, what you may call a UTI may not be a UTI. So you might be wondering, why do these normal antibiotics fail to work? There are a number of reasons, and number one is misdiagnosis. If you are treating the wrong cause, then you are assured that you will not get better. For example, a man who has prostatitis, the symptoms might feel the same as those of a UTI, but the treatment is completely different. Then for a woman who may have a vaginal infection, the drugs that were used for treating a UTI may not be used in this case. Then number two, we have what we call antibacterial resistance. This is the most common because most people out there are self-medicating. And some of you stop the medicines too early, and what happens is the bacteria becomes more smarter and it starts to fight back. And when this happens, the next time you want to use the same medicines, you will find that these medicines are no longer working for you anymore. Then lastly, we have recurrent or chronic infections. Sometimes infections keep coming back just because of a hidden problem. For example, you may have kidney stones, or you may have poor bladder emptying, and also prostate enlargement in men. Of course, I can't leave out some of the mistakes that most people are doing out there. For example, people are guessing diagnoses based on symptoms. Of course, I can't also deny that there are other conditions which you can diagnose based on symptoms, but not all. Then also we have people who reuse leftover medicines. And I'm pretty sure that most people are keeping these medicines in their houses, just waiting for another infection so that they can use them again, which is not good. And also we have a number of people who avoid doing lab tests to confirm what exactly you're suffering from. And lastly, I will talk about the confusion between these UTIs and other infections that do affect our reproductive system. For example, bacterial vaginosis, we also have PID, we also have vaginal candidiasis. So when all these are present, they will delay healing, and in the end, we shall cause a long-term damage to our kidneys and also to other parts of the urinary tract. Yes. So what would be my recommendation for someone who is undergoing such challenges? You've tried to swallow all kinds of medicines, the infections don't seem to be getting better. So I would recommend you to always have a urine test done before taking that antibiotic. Always have a urine test done, and whenever I see my patients, I always ask them to do a urine culture and sensitivity, and for men at least to also do a semen culture and sensitivity test, because this will guide your clinician to know which exact bacteria is present, and also guide him on what medicines to use that can kill that kind of bacteria. And also, I always advise you that whenever you have symptoms that have persisted for more than 3 days, to always seek help from your healthcare worker, the qualified one. And the next thing I will also advise that you take enough water, and when you get that urine, make sure that you don't hold it for long. Then also avoid taking antibiotics unnecessarily. And also when you're given these medicines, make sure that you complete the dose that is given to you. For women, I would advise you that there are certain things that you should do to make your hygiene a little bit more better. And some of the things that you can do is whenever you go to the toilet, how do you clean yourself? Some of you, when you're cleaning yourself, you clean yourself from back to the front. That thing is not okay. It is not a proper practice, because when you do that, you introduce the E. coli from the rectum into the genitals, and in the end, you start having these chronic or persistent infections. Then for men, especially those who are aged 30 years and above, I recommend you to have your prostate checked, because this will help you to know if your prostate is normal, is it inflamed, or is it enlarged, so that you can know where to start from. Yes. So therefore, before taking that antibiotic, just remember one thing. What you may call a UTI may not be the one, because healing starts when you understand what happens in your body. Don't just treat symptoms, treat the right cause. Thank you for tuning in to Bulamu Podcast Talk Show, the space to inspire, heal, and transform. I'm your host, David Nyamurangwa. See you next Tuesday. Thank you.